The management services agreement between Cone Health and Carolina's healthcare system goes into effect in October. What should you expect? Also, what would you do if somebody gave you $1,000 with instructions to use it for the good of our community? We're going to meet one of our golden ticket winners. All that and more in this month's Code View. Look for people asking lots of questions in the coming months as the management services agreement with Carolina's healthcare system goes into effect. Teams from Carolina's healthcare system will visit areas across Cone Health, looking at what we do and how we do it. Their task is to find ways to improve quality and patient care and to lower costs.
We believe it'll take about 6 months to fully put it together, and then after that we will select from that plan what we actually implement here at Cone Health. But it'll take the first 3 months around the first part, infrastructure, material supplies, and then later we'll get into the next 3 months, probably 6 months in total.
Rice expects most of the savings to come from better pricing for materials and more favorable contracts. There won't be any layoffs related to this agreement. The largest and last major go-live for Cone Health Link is scheduled November 4th. That's when Moses Cone Hospital, Wesley Long Hospital, and Behavioral Health Hospital start using the new electronic medical record system. While it's natural to focus on using the new software, don't forget the patients. And when you hit those moments that you want to blow off steam, take it away from patient areas.
There may be some times where it gets a little frustrating in the first couple weeks, and we just want to remember it's okay to vent. We want to do that off stage from patients, so find a place away from the patients to be able to vent, be able to find some support from your colleagues, and then kind of come back on stage back with the patient.
Speaking of patient care, do you know any emergency department nurses who should work for Cone Health? If you know any experienced ED nurses who fit into the Cone Health culture, you could earn $3,000. With the new ED at Wesley Long Hospital and an expanded ED to open in North Tower, Cone Health needs more nurses.
We're really looking for nurses that have experience already so they can hit the ground running. So when we have these expansions, we have the staff to support.
If the nurse you recommend makes the Cone Health team, you'll get $1,000 once they complete 31 days with Cone Health. You'll get another $1,000 on their 6-month anniversary and the third $1,000 check on their 1-year anniversary. If you really want to dazzle them about working as an emergency room nurse with Cone Health, show them the new Wesley Long Hospital ED. The $18 million project put a new emergency department near the front entrance of the hospital.
It means a new place for them to be able to work in that is spacious enough for all our patients to be cared for and in private rooms. And for our staff, it improves our morale of the employees because they have proper equipment, brand new space, a lot of space to work with.
The new emergency department has 25 private patient care rooms, 9 triage minor care rooms, and its own CT and imaging areas. When it comes to caring for our patients, one of the best things you can do is also one of the simplest. Wash your hands.
Washing our hands can save lives. In the healthcare system today, over 2 million people this year will have hospital-acquired infections.
That's why Cone Health is starting a new effort to remind employees of the importance of clean hands. And unlike past campaigns, this one is also targeting patients and visitors.
We will have window decals on the mirrors. We will also have marketing materials on the back of the stall doors to let people know how many people leave a restroom and don't wash their hands.
This campaign will also encourage patients to ask caregivers and workers if they've washed their hands. October means employee benefit time. Employee benefit fairs will be held on hospital campuses the first week of October. While it's very easy to just elect to keep your current benefits, you may want to drop in on a benefit fair and make sure you're getting the best selections for you.
It's important for you to think about your benefit choices every year. Even though we have a system that allows you to automatically keep the same benefits year after year, it's still important to think about what the benefit changes might be and if you would like to make any changes each year.
One notable benefit change. If you select a primary care physician from a list of those belonging to Triad Healthcare Network, you won't pay a copay or a deductible for visits this year. Don't forget to go online and make your United Way contribution. The employees of Cone Health are among the most generous contributors to the Guilford County and Rockingham County United Way efforts. While this year's campaigns aren't quite as visible as years past, it doesn't mean they aren't as important.
There's still people out there that are hurting. There's still school children that go without meals. There are still senior citizens that need help. There is still, Cone Health is partnering with the Sickle Cell Foundation to build a sickle cell center, which is a United Way Cone Health combined project. I would say that the needs out there for the community are probably greater than they've ever been.
Donna Overby is one of a dozen lucky employees with a decision to make: how to give away $1,000 to make the most impact on our communities. At the People Excellence celebration at the Coliseum, Donna found a golden ticket in her goodie bag.
When I opened the bag and was going through everything, I thought it was just some Cone cash that everybody received. And somebody said, "You've got the ticket, you've got the ticket." So I was excited.
Overby is using her $1,000 to help the Out of the Garden project. The organization makes sure children have something to eat over weekends. One final thing on the employee benefit fairs, and that's flu shots. Don't forget, you have to get your flu shot. These are mandatory across Cone Health, and you have until January 4th to get yours. That's it for this edition of Code View. I'm Doug Allred, and I will see you next time. Ha ha. Ooh, can I have one of those dinosaur band-aids? Yeah.